As we've seen tonight, public servants have made many massive contributions to society over the past year. But perhaps none more important than the development of a vaccine to fight the COVID-19 pandemic that has been raging across the world. The vaccine was developed by Dr. Barney Graham and Dr. Kizzmekia Corbett, and it has saved hundreds of thousands of lives. And it has also given people hope for the future at a time when it seemed like hope was running out. Which is why I am so proud to present the Medal for Federal Employee of the Year to Dr. Barney Graham and Dr. Kizzmekia Corbett.
I'm Barney Graham, Deputy Director at the Vaccine Research Center at the NIH campus in Bethesda.
I am Kizzmekia Corbett, and I am a former research fellow at the National Institutes of Health in the Vaccine Research Center.
The achievement of Drs. Graham and Corbett in the development of a COVID-19 vaccine is truly transformative. They created the precise conformation, shape, and stability of the spike protein that serves as the basis for essentially all of the COVID-19 vaccines that have proven to be so successful. By their fundamental basic science that they had been working on for years, they were able to get the right conformational shape of that molecule to stabilize it by inserting certain mutations to allow it to be used in a highly effective way to create the COVID-19 vaccine. Their work truly is the underpinning of why we have a successful group of vaccines against SARS-CoV-2.
I just do the science that I love to do and hope that there is some translation to human health like we've seen with this particular vaccine. I never in a million years thought that my career would take me in the direction of working on a vaccine that had such global impact.
Many of the threads of my career all converged in this big event, and so it's interesting to think about all the steps it took, all the people and influences, and took all the different iterative ideas coming from different directions that it took to really have this event work out the way it did.
Sometimes when people are working together as a team, they have to get to know each other on the fly. But Dr. Graham and Dr. Corbett go way back. I mean, actually, can I call you guys Barney and Kizzmekia? I mean, I feel like we're friends. I certainly fangirl for both of you. I have your vaccine in my arms, so I feel like we're close. I'm Barney and Kizzmekia. Okay, that's what I'm gonna say. Barney and Kizzmekia, as I was saying, they go way back. I mean, way, way back.
I first met Dr. Corbett when she was in high school. She wanted to be a scientist and solve problems that are at the laboratory bench. She loved biology, she loved data, she loved these things that we all share about our love for science. And so I saw in her someone who really had a good chance of becoming a professional scientist.
When I first met Dr. Graham, I was very much into this aspect of using science towards the public good. And so I interviewed for an internship in his lab. I like to think of Dr. Graham as a superhero. He was known as the vaccinator. He's this man who is really one of the world's experts in vaccinology. And vaccines really, by nature, have a public health angle.
We were reviewing what she really wanted to do as she grew up, and she said, well, I want to have your job. That's my dream, is to have your job.
And that obviously did not happen, but I'm on my way, at least.
Kizzmekia has always been the way she is now. She just wasn't being seen by the whole world. She was always ready for the spotlight, even back when she was very young.
Dr. Corbett and Dr. Graham were able to get the vaccine into development astonishingly quickly. But in maybe one of the all-time most frustrating twists, the speed and the efficiency of the vaccine has led to doubt about the vaccine. It's like some people can't believe just how good my friends Barney and Kizzmekia are at science.
One of the big problems we face is that people are nervous about how the vaccine was developed so quickly, and did we take shortcuts? This was actually a 40-year project. This started from the 1980s, trying to get to an HIV vaccine that we still don't have. But the technology that we've made and developed to work on HIV vaccines has all been poured into this big project. The other element of this was the work that was done on another virus, the almost exact approach or thinking about how to take the protein, stabilize the protein, use that as a better vaccine antigen. That was all done 7 or 8 years ago. And then the thinking about using the MERS coronavirus as a prototype for what we would do with a new coronavirus, that was started at least 3 or 4 years ago.
I can't even fully wrap my own head around all of the tiny bits of science and funding and information and discovery that had gone into these vaccines for COVID-19.
I want people to have confidence that these vaccines have been fully vetted, fully studied, and we're lucky to have them.
I really want to thank Drs. Corbett and Graham for everything that they've done to get this vaccine out.
Drs. Graham and Corbett represent what is really great about public service, because these two brilliant individuals have devoted their entire careers to doing the kind of fundamental, basic, and clinical science that leads to discoveries that really have an impact in such an important way on so many people. That is the definition, in many respects, of public service, doing things for the betterment of mankind.
The Sammys are an opportunity to shine a spotlight on the unheralded public servants doing amazing things for America each and every day. Just look at this year's Federal Employees of the Year. Doctors Barney Graham and Kizzmekia Corbett.
During a challenging year, they kept the country going by giving us the COVID-19 vaccines that are now keeping so many of us safe during this pandemic and allowing us to return to a sense of normalcy. We are so amazed by your tireless effort and your monumental achievement. You deserve every bit of thanks, gratitude, and recognition coming your way.
You all saved our bacon, literally, and because of your brains and heart and incredible work ethic, you allowed us to really see a light at the end of a very dark tunnel.
You represent the best America has to offer and inspire a new generation to greatness.
I know you've been doing this work for many, many years, and now you have saved millions of lives.
It's not often you can say that to someone, but we're all gonna get back to living normal lives in America, and that's thanks to you.
You guys are the real life superheroes that just came to save the day.
What you've done for this country and the world, it's just indescribable.
Dr. Graham, congratulations on your historic career. And Dr. Corbett, cannot wait to see what you do next.
Your work has saved countless lives and is a historic achievement in science and medicine.
I've worked with a lot of federal workers. You guys make the country run. I really appreciate it and take it personally.
You are all unsung heroes. Your work and service to our nation is often unrecognized, but tonight we honor you and express our gratitude for your service.
Honestly, you deserve a massive parade with bands and balloons. But I am no longer permitted to associate with large balloon animals after an unfortunate run-in with Snoopy during the Thanksgiving parade.
I'm glad to help recognize today's honorees for their essential role and to thank them for the truly incredible work they've done on behalf of our country and the world.
From all of us at Microsoft Federal, thank you for your service to America.
To Drs. Corbett and Graham, as well as all of the other winners and finalists, thank you and congratulations. It's an honor to recognize all that you have done and continue to do for our country.
I thank you for your continued service. All of us are grateful for your work and your dedication. God bless you.
Please give a warm welcome to last year's Federal Employee of the Year, Dr. Anthony Fauci, and to Jeff Zients, White House COVID-19 Response Coordinator and Counselor to the President.
Thank you. Thank you. So most of you know the basic sequence of events that got the COVID-19 vaccine to the finish line quickly, just as you've heard, but fewer people know Barney and Kizzmekia's roles. So I'm pleased that we can give them the recognition that they deserve, because their innovation was one of the truly monumental achievements of modern medicine. Thanks to Barney, Kizzmekia, and their team, just days, literally days, after the virus gene sequence was posted online, Moderna was able to manufacture the first doses of its coronavirus vaccine. The human trials began just 65 days later. Of course, as the video explained, this speed was based on literally decades of research. But still, we have been watching truly history in the making.
Bottom line up front, Doctors Graham and Corbett's innovation forms the backbone of nearly all of the effective COVID-19 vaccines in use today. Their work has saved hundreds of thousands of lives in the US and countless lives around the world. Just 3 weeks after President Biden took office, we visited the NIH lab where Doctors Graham and Corbett co-developed the mRNA vaccine. On the visit, speaking to Doctors Graham, Corbett, and Fauci, and all of the talented and dedicated NIH staff, the President said, "Your work made possible the remarkably rapid development of the COVID-19 vaccines we have today. People were initially talking years before we'd have a vaccine. On behalf of a grateful nation, I want to thank you and your families for your work and your sacrifice. There's no doubt your family sacrificed a great deal for the endless hours you put in to save the rest of us. You're the best, the very best America has to offer." As always, President Biden captured it perfectly, and I could not agree more. Please join us in congratulating the recipients of the Federal Employee of the Year Medal, Dr. Graham and Dr. Corbett.
Hard to know what to say after all that. It is true that we are used to not having quite this much attention around our work, and it was really the events that occurred that kind of brought all of what we had done over these last many years together. So I want to start by thanking my wife, Dr. Cynthia Turner Graham. I couldn't have gotten through this last 2 years without you. And I want to thank the army of people that helped make this vaccine possible. It's hard to count how many people helped. The Vaccine Research Center itself is almost 600 people, directed by Dr. Mascola, whose lab worked with us on some of the coronavirus biology. Dr. Fauci envisioned the Vaccine Research Center 25 or so years ago, and that's why it exists. And we're still trying to make an HIV vaccine in which dozens, if not hundreds, of people are devoting almost all their time. There was another several thousand people who did the clinical trials, and over 200,000 people were volunteers participating in the clinical trials. So this literally was the work of thousands or hundreds of thousands of people. I just want to make one point. Then I'm going to turn it over to the next generation, because it's time. The role of basic science is, this is a great story about the role of basic science and how it can provide unexpected benefits and solutions to unmet medical needs. And so I thank the partners for their vision of how to support government work, because this kind of work cannot be done really outside of the government. You have to spend public dollars on public health. It doesn't work any other way. And so I'm grateful for the opportunity and privileged to have been able to use the resources of the Vaccine Research Center over these last 21 years to do the work that we've done. And now I want to introduce you to Dr. Corbett, who you already met, but I want her to have the last word, because she represents the next generation of scientists who are going to solve all the rest of the problems coming at us.
So that was very kind, and it's very much like Dr. Graham to give me the last word. He has basically shuttled me through my career for the entirety of it since I was 19, in large part because he took part in what is a program called the Undergraduate Scholarship Program at the National Institutes of Health, which is congressionally funded, at least the money comes from Congress, where people from underrepresented backgrounds get to work in laboratories at the National Institutes of Health, which is by far the greatest biomedical research institute in probably the world. And I got to Dr. Graham's lab when I was 19, and I basically never left. Even now, I must say that 2 of the students that went off to medical school are literally texting me because they have no idea what the SAMIs are, or that I'm here telling me to make sure I edit their discussion tonight of their manuscript. So I'm only supposed to have a minute, and I thought that that was probably only enough time to thank God, and so I do that first. And so thank you to God for all of this. And you know, as Dr. Graham said, it really does take a team. It took basically an entire Vaccine Research Center effort, and then our collaborators, and then cross-institutionally within the federal government. But the team that I hold most dear are the team of researchers who came to the laboratory and trusted me with that part of their career right after undergraduate, where I didn't really know what I was doing, but somehow we got through it. One of whom is in the audience today, Annie, who is still at the Vaccine Research Center, and we said that we would not leave her hanging, but she's carrying the torch forward with a lot of the mRNA 1273 specific work, so thank you, Annie. 2 others, Jeff and Olu, who are texting me about their paper, which is actually a pretty cool other vaccine concept, I must say. And then Cynthia, who is off at medical school. That team of students really worked almost 24 hours throughout the entirety of the pandemic in rotation. And they didn't stop until they got a lot of things right. And they often don't get the type of recognition that Dr. Graham and I get, but they deserve all of it, including endowments when they get labs, cough, cough, if you hear those names and you know friends with a lot of money, and scholarships to medical school, cough, cough. Annie's applying right now. But then, you know, also to Moderna, because when Moderna and us, we started to collaborate, they were a very small biotech company. I heard from Nubar, who I actually got to sit with at dinner the other night. I've come to that level where I get to sit with the founder of Moderna, whatever. Anyway, he said that before the pandemic, they'd only made 2,000 doses of any vaccine. And they were able to really manufacture this product in such speed that we got to clinical trial in a record 66 days. And largely because we had this trusted collaboration. And so while we sit in our posts in federal service, I just want to remind everyone here that it is very important to embrace companies, embrace academia continuously, embrace other nonprofits continuously, so that as America in totality, we can get these kinds of things done for, as Dr. Graham says, all the other viruses. And I was certainly, although he did pass the torch to me, I cannot do it alone. So thank you.